Hello and welcome to today's event, Are You Prepared for a Mass Violence Event? I'm Lucian Canton, Senior Fellow with the Center for Digital Government, and I'll be your moderator for today's event. First of all, I just wanted to say thank you for joining us. I know you're in for a very informative session. I've been talking with our speakers beforehand, and I think it's really going to be a worthwhile session. Before we begin, though, I do have a couple of brief housekeeping notes for you. A recording of this presentation will be emailed to all registrants within 48 hours. You can use the recording for your own reference or feel free to pass it on to your colleagues. This webcast is designed to be interactive and you can ask questions at any time during the presentation. You should see a Q&A box on the bottom left of the presentation panel. Please send your questions in as you come up with them throughout the presentation. Our speakers will address as many of these questions as we can during the question and answer session towards the end of our webinar. If you'd like to download a PDF copy of the slides for this presentation, you can do so by clicking the Webinar Resources widget at the bottom of the console. Also, during today's webinar, you will be able to connect with your peers via LinkedIn, Twitter, and Facebook. Please use hashtag EMLive, that's hashtag EMLIVE, to connect with your peers across the emergency management platform via Twitter. At the close of the webinar, we encourage you to complete a brief survey about the presentation. We'd really like to hear what you think, and that'll help influence what we do for future webinars. If you are unable to stay with us for the entire webinar, but would like to complete the survey as much as you're able, please click the survey widget at the bottom of the screen to launch the survey. Otherwise, it will pop up once the webinar concludes. We recommend you disable your pop-up blockers, and if you are experiencing any media player issues or have any other problems, please visit our webcast help guide by clicking on the Help button at the bottom of the console. Joining me today to discuss this very timely topic are Steve Cremando, Principal with Behavioral Science Applications, and Michael Scott, Senior Program Manager with Everbridge. Stephen Cremando is the Principal of Behavioral Science Applications, a training and consulting firm focused on human factors in crisis prevention and response. He is also a deputy and police surgeon with the Atlantic County, New Jersey Sheriff's Office, an advisor to the Morris County Active Shooter Rescue Force, and has an extensive background in emergency medical services. He was deployed to both the 9/11 and 1993 World Trade Center attacks and has served with New Jersey's Anthrax Screening Center. Steve is a board-certified expert in traumatic stress and holds a Level 5 certification in Homeland Security. He serves as a consultant and trainer for many multinational corporations, government agencies, major city police departments, and military programs. Michael Scott is the Senior Demand General Manager for Everbridge. He spent the past 5 years at Everbridge responsible for marketing to higher education, government, and security organizations. Given the events of the past few years and the most recent event in Charlottesville, our topic today is extremely timely. Mass violent events are becoming more common, and they stress our response systems to their maximum. Our speakers today look at why these events are different from mass casualty incidents and how we can prepare to respond. So without further ado, I'd like to turn things over to Steve. And Steve, all yours.
Thank you very much, sir, and thank you, everyone, for taking the time out of your busy day to join us for the program. I hope you'll find the information both interesting and actionable. And let's start right here on the cover slide. We're looking at photographs just days ago from vehicle attacks in Barcelona. And as you follow the news, certainly that was a string of events in which there was a second attack in another Spanish city and bomb detonation. So this issue of mass violence is something that is on the uptick when we look at it statistically. And as was mentioned in the introduction, it certainly challenges our response capabilities. And we need to kind of understand this. So I'm going to move kind of through a natural trajectory in how we understand and discuss this today. And it follows the basic mitigation approach, if you're familiar, which is understand the hazard, understand the defense, and act in time. And I'm going to follow that pathway through our materials. To just clarify, as we discuss mass violence today, I'll be talking primarily about things like bombing, mass shootings such as active shooter attacks, the recent spate and uptick in vehicular assaults that we've seen, in combination the potential use of fire as a weapon, but also mass kidnapping and hostage-taking situations. What we're not discussing today are things like natural disasters, technological disasters, and even though they can constitute mass casualty events, weapons of mass destruction events like chemical, biological, radiological, and nuclear hazards are not going to be part of our discussion, as are disease outbreaks, which obviously many can result in mass casualties. So we're talking about purposeful infliction of mass violence. And as a starting place, I want to really recommend to all of you on the call that if you do not already have these documents on your bookshelf, take a quick look at these two, Improving Active Shooter and Hostile Event Response, and this is by the Interagency Board from Homeland Security, First Responder Guide to Improving Survivability in IED or active shooter incidents. Both provide some very, very sound guidance and action plans for mass violence situations. And obviously both of these are addressing things that are purposeful. That changes really the behavioral and the tactical response, the fact that someone has purposely sought out to seek the maximum casualty event. So let's start, kind of as I mentioned, at this logical launch place, which is understanding the hazard and kind of what's new. Why are we discussing and how are we discussing mass violence different today than perhaps we had in the past? Now, very interesting was a turning point just a little more than a year ago. We're a little bit past the one-year anniversary of the Orlando shooting in June. And the shooting, of course, was horrific. It was, since 9/11, the single greatest terrorist attack on U.S. soil. And lots can be said about that, and lots has been said. But what I'd like to focus on is really kind of what happened next. And what happened next is Al-Qaeda, which many of you know, publishes a very slick, glossy online magazine known as Inspire. And you're certainly welcome to check that out online, but I'd be a little bit careful, what you're browsing at home. Al-Qaeda came out very, very quickly and published this this operational guide. And essentially, to summarize, there was the normal kind of rhetoric about praising the attacker and all of that. But what it really said was, this is the template. This attack method, this kind of operation, really for the true believer, is a template for you to follow in conducting other operations. And they saw this as highly significant and highly successful. But more important to us in the language of this guide are these emerging terms. And the first is this idea that those who are inspired to follow this ideology are to select general gatherings. So when we start to think about vehicular attacks, we're talking about large outdoor gatherings. When we start to talk about active shooter events, by definitions, they target populated areas. So task one for the attacker is to look for these places where there are large crowds. We're looking to create a mass casualty event. And the second part, and this is a shift, is target the general population, which now the terrorist groups are calling the combatant public, which means compared to maybe 3 years ago, where the call to action was more focused on attacking law enforcement officers or military personnel, this is a gloves-off approach. This says everyone in the states is seen as a combatant and it's fair game. So if you combine these two concepts, large public gatherings and the entire population as combatants, you end up with a much larger kind of net, casting a much larger net in terms of the potential targets and our vulnerability. And then we have a second emerging concept that goes in hand in concert with this, and this is the idea of hybrid targeted violence. Now, if you haven't heard that term used before, it's attributed to Tracy Frisano and Matt Snyder. Tracy lives and works relatively near to me in northern New Jersey here as a deputy police chief in Montclair, New Jersey, and she's an academic and scholar in this area. And in the Homeland Security Affairs Journal back in 2014, her and Matt coined this term, in which it's talking about really this more sophisticated attack platform, specifically targeting potentially multiple locations with multiple attack means and perhaps using multiple attackers. Now, there's been a number of these. This is not something that's brand new. If you look at it, probably one of the very best scenarios of this as an example would be something like the siege in Mumbai. But certainly we can go back even before that to the Beslan School siege, the attack in the Westgate Mall in Nairobi. Aspects of this apply to the Boston Marathon attack, and they certainly apply to San Bernardino. So these are not, as I said, completely unheard of or brand new, but there is, chatter and propaganda in the terrorist literature that is pushing for these changes in their trends. What you would expect then is, if we're discussing today mass violence, there is being promoted amongst those who would perpetrate these acts, not just a call to action, but instructions as well. So if we're looking at something like ISIS's magazines, which are published online, which would be Rumya or Dabiq, and Al-Qaeda's magazine Inspire, these are giving very, very clear instructions, not just to create this attack, but how to, what type of vehicle to select, and how to carry on a follow-on knife attack once your vehicle is stopped. So this is a different sort of scenario. When we talk about hybrid targeted violence, we're talking about a very motivated, very tactically competent sort of attacker. This is, someone really skilled, or some group. Multiple operators working in small tactical units. That's certainly what we saw in Mumbai. Very effective and clear communications and coordination. Purposeful luring of first responders into threat. Purposeful use of other attack means such as CBRN or fire, and the use of very sophisticated military-style weapons and explosives. So you have a very different picture here. You have a call to action for the true believer to conduct mass violence of this type, and to conduct it in these very, very complex sort of ways. So as you start to think about that, then what's the result? I mean, and we've seen this. This doesn't take a lot of creativity. That the attackers, if we think about the public gathering, whether it's vehicular attack or mass shooting and otherwise, are picking target-rich environments. They're looking to maximize casualty count. Now, obviously, there's an attraction to symbolic targets as well. If you're thinking about something like Patriot Day in Boston, or you're thinking about Bastille Day in Nice, France, there's a real drive to pick targets that are both target-rich and symbolic in nature. So these attackers are looking to create the same dynamics. Think about this very quickly. When you think about the definition, operational definition of an active shooter, classically the definition has been the person seeking a target-rich or a populated environment, but also a confined space, right? So there was limited opportunity for escape. And that certainly would be true in the movie theater in Aurora, Colorado, as it would be in the, in the party room or the conference room at the San Bernardino shooting. But if you compare that to mass vehicular attacks, you've seen images on the news of people diving from the Westminster Bridge, diving from the London Bridge to try to escape the path or get out of the path of those oncoming vehicles. So same thing, we're picking narrow streets where we actually can create high numbers of casualties, but also people caught up in stampedes, which are likely to add to the number of injured. So they're looking for those same dynamics. Obviously, we understand the attacker always has the tactical advantage in the onset of this event. Now, to me, it's a separate discussion. I think it's time to start educating the public about how to anticipate and protect themselves in things like vehicular attacks, since we're already doing such a good job in educating them on how to protect themselves through methods like Run, Hide, Fight, Alice, or Alert in shooting events. So we have to start empowering the public around these threats as well. But we should expect just tremendous chaos, other than people who have combat experience or some law enforcement officers who have deadly force encounter experiences. Most people will have no level of mental readiness to be thrust into something this threatening and this shocking. So as I said, we're going to have people running in multiple directions. We're going to have, again, high levels of noise, whether it's indoors or outdoors, making communications different at this level of stress, problem solving, decision making, is pretty well locked up. And as I said, even in the fighting and fleeing behavior, the possibility for additional injuries and choke points like stairways, escalators, things of this nature. So we want to make sure you're operating with what is a pretty clear picture of the inside of an event of mass violence. And as I said, most people are not going to be particularly prepared. This is not belittling in any way for any law enforcement partners online, but we know that in different jurisdictions, folks will have different levels of training and weaponry to respond to an active shooter or an instance of mass violence, and different communities and jurisdictions will have different capabilities in terms of the EMS response as well. So these are really, really complex, and civilians certainly in some parts of our system are probably not at the optimal levels of readiness for this. As I said, you also have the dynamics of swarms of incoming law enforcement partners, and those could be from multiple jurisdictions in different sorts of uniform, different levels of sophistication, their training and background. So it is just an absolutely chaotic environment, and unless they know otherwise, and even if they do know otherwise, it's going to be kind of shocking to wounded civilians and others to see law enforcement pass them by in pursuit of the shooter or the attackers until they neutralize the threat. And that's part of the tactical approach, but it's certainly going to add to the terror of the situation to see that the wounded are not immediately cared for. Now, that's going to be important to us as a little while. And as I said, in these environments, there's these emergency stress responses that are just overwhelming. So as we look at this then, we start to turn the corner about, understanding the defense. And believe me, I understand that was quick, and we could do an entire semester on the dynamics of the inside of an attack of mass violence. Unfortunately, there's been enough of these, at least in terms of vehicular attack and active shooter, that most of us can think back to cases we've seen on the news and have a pretty good picture of accounts of survivors and accounts of rescuers about what the inside of these situations look like. So I mentioned the two guidances early on, and those were the Interagency Board guidance and then the Homeland Security guidance. I want to focus on some pretty straightforward and useful recommendations by the Interagency Board. Now, I understand in our webinars we have very, very diverse audiences, so you need to think a little bit about what this means to you, how you adapt some of this, and some of the guidance will be kind of, really intended for community agencies, law enforcement, first responder agencies, and you need to think then, if you're not from an organization like that, if you're from some other public or private sector organization, how you understand these in terms of interacting with law enforcement and first responders, how you build the relationships, how you exercise with them, all those things that may be important pre-event. So let's dig in a little bit. These are not particularly dated. Even though this document was released just about 2 years ago, there are lots of folks who are still learning about it today. But I want to touch about some of the key recommendations, and some will be very, very familiar to you, like the need for interoperability. The mass violent event is going to require mutual aid. These events, by definition, are going to overwhelm the response capabilities of probably any one jurisdiction. You're going to need specialized resources. You're going to need additional, people power. You're going to need additional vehicles and so forth to respond to this event. So the need for, kind of our ICS or incident command concepts of interoperability and so forth, they become critical. And where do they come from? They come from training, they come from discussion and memorandums of agreement and understanding, and they come from really conjoint and coordinated exercises, so we are all on the same page. Think about this. The perpetrators have sought to overwhelm our systems, not just inflict damage, but they want to demonstrate powerlessness. They want to demonstrate that, we seem, and it's an illusion, but we seem defenseless and not ready for these things. Well, we're in a very, very high level of readiness. We could always do better. But none of us, I think, are sitting back saying, oh, this can't happen here at this point. So more important is making sure we're all on the same page operationally, so we're avoiding gaps and we're avoiding duplication and we're not tripping over each other. This has to be done from a multidisciplinary perspective, which means tearing down silos. Now, it's interesting because in a little while I'm going to talk about Rescue Task Force and the Hartford Consensus, things that start to put EMS personnel into warm zone operations as opposed to cold zone operations. And things like that actually help foster the multidisciplinary perspective because you have EMS working shoulder to shoulder with law enforcement, even in the early phase of an active shooter event in the warm zone, as I said. Intergovernmental partnerships, having certainly the first responder community, understand and be looking for central leadership, and all of this done, of course, being done proactively so that we can put our heads on the pillows at night a little bit more safely or confidently that we're in a good position or posture for response. And of course, sharing operational experiences and practices. So maybe when we do have an incident, attending the debriefs, attending after-action discussions, so we're always continuing learning. So we're going to talk about a number of different priorities, and I'm not going to read each of these. I'd like to, touch on some that are most relevant to us. And those are things that we make sure that policies, procedures, training exercises are all done in a standardized way. That fosters the interoperability, and I don't want to linger on that and kind of belabor that point. But the coordinated response becomes very, very critical. And as I said, this really requires tearing down silos and having very clear understandings about, how we stay in our lane. What are the tasks for the different disciplines and how do they do that without tripping over each other? And of course, part of that is a general NIMS or ICS concept of common operating language and forming common operating pictures. Improved integration, goes back to rapid communication. And this is something we're going to spend a bit of time on this afternoon or during the session, which is Rescue Task Force. And you see the logo there, and I want to make sure we're all on the same page in understanding that concept. Rescue Task Force, it emerges out of tactical emergency casualty care. So even though this is listed as a separate priority, it's going to overlap with the last that I spoke about. Implementing and knowing how to stand up casualty collection points and what is our proper way of managing them. And this ties back to Rescue Task Force as well, which is the use of ballistic protection by EMS and fire personnel as well as tactical law enforcement operators. And then we're going to talk a little bit about what we know in terms of the medical realities of the situation and the importance of two-way communication with the public during these crises. All of that will be critical because of the chaotic and overwhelming nature of these events. So let's kind of put this in perspective. When we're talking about these events, whether they're firearms involved, these are shooting, they're a combination of shooting and bombing events, they're that model of hybrid targeted violence we spoke about a few moments ago, we understand we're no longer talking about kind of the golden hour of EMS. We're talking about platinum minutes. We're talking about in active shooter events, the likelihood that, one, most people who die are going to die by bleeding out, and most people who bleed out are going to bleed out in the first few minutes of their injury. So, we start to think about tactical emergency casualty care. It is this kind of realization. One, it's the most common form of death, and second, it's probably a preventable form of death. That we need to go hands-on with BCON, which is bleeding control. We all, including civilians, need to have some level of readiness to start managing bleeding in these events. So when we think about something like an active shooter event, right, it's a whole different discussion about the pre-incident indicators and the knowledge that these events are predatory in nature. They're not hot-blooded killing, they're cold-blooded killing in which the perpetrator has had a long planning curve and preparation for the attack. But the case, the scenario, it also doesn't end with, it doesn't necessarily begin just with shots fired, and it doesn't end just with shooter down. That, if we think active shooter, that's over in minutes, right? Current FBI statistics tell us that 70% of active shooter cases are over in 5 minutes or less. The other grim statistic from that is once we have an active shooter situation in process, the average is another person is shot every 15 seconds. So we want to make sure people understand how to move, what it means to them in terms of safety and survivability in those events, but also this shift. Run, hide, fight, Alice, alert, all the popular models of active shooter response. They're really isolated primarily on those 5 minutes of terror between shots fired and shooter down. The incident does not end with shooter down, which means we need to shift just from our thinking about stopping the shooting, which is critical and it's a priority, to also stopping the dying. So we're looking at a slightly different paradigm now that goes a little beyond run, hide, fight, and what it discusses is stopping the killing, stopping the dying, and stopping the crying. And I'm going to elaborate on stopping the crying because it's not to say people don't have a right or should not be overwhelmed, be grieved, be crying, being hysterical. I understand that. But we're speaking about in the moment of being so emotionally overwhelmed that they're actually putting themselves and other people in more risk, in more harm's way. So one of the ways that we're starting to look at really leveraging first responders, or actually leveraging bystanders as first responders, is really two things to think about. First of all, bystanders in your environment, where this attack happens, bombing, shooting, or some combination of the above, those victims and witnesses, they are your first responders. They're going to be there before the first incoming law enforcement in most instances and before the incoming EMS. And if I said to you, most people who die out by bleeding and die out in the first few minutes, we have this tremendous importance for people to know how to go hands-on with basic bleeding control. We have a natural human tendency to help each other, that altruistic response. We want to help, but people need to know what to do. So going back about a year, the U.S. Department of Homeland Security initiated the Stop the Bleed campaign. And you can simply go to dhs.gov online and type in their search engine, Stop the Bleed, or I've embedded here the URL to take you right to there. And there's videos, and there's handouts, and there's training really that advocates that everyone, just as we advocate that really everyone should know the basics of first aid or CPR, that so many more people should be aware of the basics of bleeding control. This will be one of our biggest challenges in an attack of mass violence. And as I said, understanding the vehicle attack, the active shooter attack, other blends of this, those folks on site are going to be one of our best resources. So what do we start seeing? So what I have here kind of illustrates a concept which is known as tragedy drives innovation. And in the wake of active shooter events, in the wake of many mass violence events, we've seen the marketplace, the entry of a number of different products. And I'm not endorsing necessarily any one product or any one vendor today, but I am saying look at some of the creative ways that people are starting to consider the immediate needs in the post-violent environment. And you have these trauma kits. And, go back. If you want to think about the value of these trauma kits, honestly, this is why Congressman Giffords is alive today, is because the sheriff's officers in Arizona had started carrying these little trauma kits in their cargo pants pockets, in their tactical pants pockets, honestly, like a week or so before the attack. In the small trauma kits, which are usually sealed up, you've got combat gauze, you've got tourniquet, chest seal, airway, just the basics, of course, gloves and things like that to initiate effective bleeding control. And these are meant for folks who have actually no prior medical training and no prior, EMS background. It's to give the first responders and the bystanders some avenue of addressing the immediate medical needs. So what do we see here in the graphics? Wall kits that you may, someone may put up by their AED or by their first aid kits in the facility that are going to be packed with, 7 or 8 of these small trauma kits. The carry kit that stays behind the receptionist desk in your front of house where someone could grab this real quick and throw the smaller kits to those in need. And we actually see more advanced kits that one will provide audio prompts and talk you through applying these techniques, and even those that are combine the trauma kits with things like pepper gel, so you have an offensive capability or defensive capability as well as simply the medical supplies. So we're starting to see an era where, sadly, mass violence has become part of the culture, and we're needing to get our head around that. So going beyond kind of these new and creative, technologies or resources, we want to come back to some of the core concepts in moving forward. Obviously, common operating language. There's a strong push by DHS, by the FBI for plain language, not to be using terms, because obviously your staff and some other people may know, that a code silver in the hospital is an active shooter, but if you're a guest or visitor to the hospital, you may have no idea about that, and be curious and be running towards the hospital lobby instead of away from the hospital lobby during a certain type of code. So we want to make sure that folks in their training, in their orientation, as new hires to an organization, understand, how we will communicate, and that needs to be communicated to our external partners as well, that we're all on the same page, we all understand the commands that will be given and how we'll move. Now, as I said, one of the things that's a huge asset is the advent of the Rescue Task Force. So if you're curious, I would direct you at some point to go online and look up a phrase that's the Hartford Consensus, Hartford like the city in Connecticut. And this goes back now a few summers in which a group from the American College of Surgeons convened, and they looked at what was referred to then as CECC, Combat Emergency Casualty Care, and started to develop a variant of that, in which we have civilian emergency casualty care, in which we have now civilian EMS trained again in the same way. So what you have as we look at civilian emergency casualty care are communities that are starting to train up EMS personnel with ballistic vests, ballistic helmets, not carrying weapons, but working in small teams under the cover of law enforcement officers, armed officers, so they could enter and operate in the warm zone and go hands-on with bleeding victims that much faster. That's going to save lives. That's one of the big recommendations. As we start to move around recommendations, we understand that the need for integrated training together, including dispatch, including EMS and fire, all need to be on the same page, because we're all going to be thrust together in this. And obviously, the more realistic the training, the better. We spoke briefly about casualty collection points, and as we start to do that, the idea that EMS and others need to understand where those will be, how we will treat victims as we move them into those places, move them into the cold zone and beyond, how we do that. And also, as I said, working with our partners to understand, what breaching is about, how that will affect the survivor's experience, things of that nature. Patient tracking becomes critical in this theme, knowing that we may have multiple victims being sent to multiple hospitals. And then, as I said, almost lastly, the need for effective two-way communication in both sending out to people in the threat environment, but receiving information back from the threat environment, what is going on, where to move, really becomes our eyes and our ears. Understanding, again, that this may be happening across multiple locations, if we're using the hybrid targeted violence model, we understand that we may have several scenes going on simultaneously. So this becomes even more critical in an environment where we have the potential for multiple attackers and multiple attack locations. And then, as I said, lastly, the importance of rapid emergency notification. I've underlined it here because of its importance. There is simply no better way to help reduce the number of victims than by denying the attacker their targets through good communication. getting people to move away, getting people to move towards safety, having, again, this capability can reduce the likelihood of stampede behaviors that can result in more casualties, all convey, very, very quickly together. And these are recommendations, as I said, as we talk from these national guidances. The public needs to know what's going on, what to do, and needs to be good eyes and ears for us. And obviously, whenever you have any sort of training exercise, you have an opportunity to test out those communication channels as well. So you want to make sure you're using those very robust notification platforms. You want to make sure that they have redundant means or multiple modes of communication, voice, SMS, email, and so forth. And we need to give people information about what to do. You see my phrase here, action binds anxiety, taken from Dr. Peter Sandman. People do their best at containing the stress of a situation when we give them very clear directions about what to do, what not to do. Be very direct, what's happening, where it's happening, what to do, and how they receive new information as we go forward. And as I said, do it all in plain language. You'll also need these communication tools in the post as the event winds down and as it starts to be made safe, how people know it's all clear, what the location will be for family unification of family assistance centers, how to coordinate and receive the right support from victim witness or crime victim supports, your organization's business continuity strategy and all your business continuity tasks. All of these things will need to be conveyed, and believe me, they may need to be conveyed for weeks to go. So in wrapping up, I want to take something that's brand new and close out with it and move on to Michael and then to questions and comments. And this is from a peer review done of the Orlando shooting and a few things that really rose to the occasion during the peer review and after action process. And I'm just going to touch on the bullets. I'm not going to read each to you. Anticipate the needs of your staff, both if it's a workforce that was affected, if it's our EMS and our first responder personnel. These are highly, highly traumatic events. I've worked with elite law enforcement and military units for years, and even people with that level of experience still find these to be absolutely numbing. Anticipate that you're going to need much more than you have, much more of everything in terms of resources. So start to form those mutual aid relationships and those relationships to get whatever you need, because you will need all of it in a mass violent event. Understand certainly that there's going to be an ongoing need for managing relations with patients, with responders, but also incoming VIPs and dignitaries. And you may even be challenged with things like donation management. Think about Newtown, Connecticut was overwhelmed by the number of teddy bears they received from around the world. And then we talk about additional space for family reunion centers, family assistance centers, and as I said, how we plan and conduct exercises with partners on all of those. Do not just exercise the response phase. You need to exercise standing up family assistance centers. You need to exercise the communications capabilities. These are so complex, as I said, and they really can affect all of us in every jurisdiction, that you cannot in any way say, we've got this. We have all the moving parts. I think we'll do fine. As I said, under crisis conditions, people do not rise to the occasion. They fall to their training. You must train for the mass violence scenario based on our current threat picture. That is my story, and I'm sticking to it, so I'm going to pass the baton back to our other speakers.
Thanks, Steve. That was, wow, a lot of information in a short time. Our next speaker is Michael Scott, the Senior Program Manager from Everbridge. Michael?
Thank you, Steve, and thank you, Lucian. So with that, let's move on to my section. So given our time, I'm going to try and go through this quick so we can have some ample time for Q&A with myself and Steve after this. So I'm going to go through some best practice for managing these major events with a solution like Everbridge. And I know we were talking mostly about, we covered at a high level major mass events. So I'm just going to dive, into specifically active shooters just for the sake of an example. And one of the things Steve mentioned is that will connect to, our solution is being able to get, the best assessment during getting as many details as you can, but doing that also as quickly as possible, because during these events, as Steve mentioned, time is the essence, and you need to simultaneously be, coordinating your response teams, whether that's EMTs, emergency services, but also, your law enforcement agencies, while letting your community know what's going on and people who are directly impacted inside the, a building or inside a given area, letting them know to take shelter. So, in order to keep your residents safe and coordinate effective response, some of the things you should consider is speed and accuracy. And what I mean by that is automate the process when possible. With a solution like Everbridge, you are able to build out complete incident templates for a given scenario, whether it's, a mass casualty event like what, we recently saw in Barcelona, or, a more contained event like an active shooter in an office building. You can build out the entire incident scenario, including messaging and what groups will get messaged within the Everbridge system. Additionally, make sure you're, with your solution, whether it's, you guys are leveraging Everbridge or, a notification system you guys are using, try and be as location specific as possible. Meaning, if you're able to draw a polygon on the area that's affected and send them specific messaging, and then outside that polygon, make sure other people are getting the appropriate messages as well. So, for example, if you're on a campus setting and building A has an active shooter scenario happening, make sure that they get the message appropriate for them, while as people outside that polygon of that you drew for building A, make sure that they're getting a separate message. And when sending any alerts, especially those that are critical and time sensitive, make sure you don't just blast out a message through one contact path. Make sure you're sending a message to as many paths as possible for these very critical and urgent situations, meaning send it through not only voice and text, but also email. If your system allows, like Everbridge, integrate with your siren, your desktop alerting, so no matter where people are, there's a high likelihood they're going to see this message and get to safety. Beyond that, within your response teams, make sure that that you're sending out alerts and keeping them up to date with information regarding areas being closed or buildings being closed, and also when it's safe and reopened. It's important that your solutions can integrate with other systems that you have that have HR data, meaning contact data, such as schedules and things like that, because if you're trying to quickly pull your teams together, it's important that you know who's on call without having to look through a physical schedule, and also being able to select the individuals who have the proper skill set without having to look through their individual files or looking through group files. So with that, just to give you guys a very high-level overview of who Everbridge is and what our goal is, we're an enterprise software application that's primary goal is really to keep people safe in businesses, organizations, universities, hospitals, keep them running. We pride ourselves as a critical event management solution versus just a standalone emergency notification solution. And the reason for that is we're not just used for emergency situations. However, we do handle those, such as severe weather, active shooter, or hazmat issues, but also for operational situations such as an IT outage, a Wi-Fi outage, a product recall, or a cyber issue. Our customers are spread throughout many major industries, including having 9 of the 10 largest investment banks, 8 of the 10 largest U.S. cities, 25 of the 25 busiest North American airports. They're leveraging us for, from one of these incidents to all of these incidents, depending on their, specific needs, and which is why we're truly a critical event management platform. So at this time, I'd like you guys to fill out our poll question. if you'd like more information regarding Everbridge and how you can partner with us for scenarios related to active shooter or any of the other ones I mentioned in the previous slide, feel free to answer yes. If you're not ready at this time or it's not something you guys are interested in, definitely feel free to answer not at this time. We'll give you about 45 more seconds, and then we'll move on to the Q&A.
Great, thanks, Michael. While we're waiting for folks to fill out the survey, I'd just like to go over a couple of quick things with you. One is a reminder that you can ask questions of Steve or Mike just by, at the lower left-hand side of your screen, there's a Q&A box. So you feel free to enter your question, and we'll get to as many as we can in the next 15 minutes. If you are, we had a number of questions about copies of the presentations and copies of the slides. There is a PDF of the slides available to you in the webinar resources box at the bottom of your screen, and a copy of the slide presentation will be sent to you within the next 48 hours. You'll receive that by an email, and again, you're free to use that for your own use or to distribute that to your colleagues, and please feel free to do so. So, give you just a couple of more seconds here to finish this up, and then we'll go to our first few questions. Okay, we have a lot of questions here. Boy, where to start? One second here. Let me see where I can get to the bottom here. Steve, this is kind of a technical question, but it was one of the first ones that came in, and it's about standard weight and size for barriers if you wanted to, say, close off a street for public events or demonstrations. Is there such a thing?
There are guidances. You're a little bit outside of my scope. There are those firms, certainly who are building bollards and are more involved with the physical security standpoint. The other part too, there tends to be two parts of that. One is, what are the standard or what are the recommended, dimensions and weights. And the other thing you do have to check with are, kind of your city codes, whatever your municipal codes are about the placement of those devices. So you don't want to do anything and invest a lot of money independent of having done the research of those. It's going to depend. So I don't myself, it's just a little bit outside of my scope of expertise. I know that there are standards, and I know that those firms that deal in them are probably very well suited to provide you those stats. And but as I said, I've learned the hard way working with some of our clients to take the extra step and see if there are any municipal sort of requirements or restrictions on what you do, how big they are, their look and feel, and how close they are to the street line.
Mm-hmm. One of the things that you talked about is the importance of educating the public, and sort of the way we've done for earthquakes out here in California, the way we've done for active shooters. What would you think would be some of the best ways for the public to protect themselves in response to these type of attacks? And are we starting to do any research on that? Do we have any sort of idea of what we can tell the public now? What's our message?
Well, at the lowest level, it's about situational awareness. And, when we go to public gatherings, and remember, this tends to be the target of mass violence, right? So whether it's the sporting event, it's a concert, it's fireworks on Bastille Day, whatever it is, our heads tend not to be in the safety element. We're enjoying the show and the event, and we should. And sometimes I say to people, you need to think about the safety part of that. And folks are like, well, that kind of ruins it for me. And it actually doesn't. You will enjoy the event more so if you know that you've kind of thought about safety. So let me be a little more specific about that now. So if I'm saying to someone, listen, I'm going to a parade. I'm taking myself, my spouse or partner, my kids, we're going to the parade. Where do I stand? What have I learned? Well, we learned that most vehicle strikes they happen along curb line. I don't want to be standing at the curb line. I want to know if I'm standing on a street to watch an event, whether it's a marathon or a parade. I'd like to stand at a street corner because in these vehicle attacks, the attacker tends not to turn. They do tend to swerve, so they sweep up more victims, but they tend not to turn corners because they don't want to lose momentum. This is in the instructions given to the vehicle operator, to the attacker, as they learn and they study through their online kind of terrorist networks. We know that you want to have you want to understand the stampede dynamics and how you go into an environment looking for the 2 R's. Now, when I teach folks about situational awareness, this is the way I teach it. You're looking for the 2 R's, risks and resources. Risks are those things that may hurt me, so I want to be aware of kind of abnormal vehicle movements or sound of screeching tires and things of that nature, those kind of risks. I also want to be looking for resources. What may help me? What are the people, places, and things that may help me in an emergency? So if I'm standing outside at a public event, something goes sideways, am I positioned near a doorway that I could duck in, an alleyway, a place where I can take refuge? And that's why I recommend street corners, because if you're at a corner, you could retreat down the side street, because we know the vehicles tend not to stop, slow, and make turns. So what we're trying to say to the public is, listen, whether it's active shooter, it's vehicle attack, or some combination of these, you need to go in. Your job is to go in, have a great time, but go in with a high level of situational awareness. Understand these risks. Understand that there are some places you will be or things that you will do that could actually reduce your risk and improve your survivability, and we need to start to discuss that. We discuss run, hide, and fight with people around shooters. We need to start talking about what are the things you should do at large outdoor public gatherings that will improve your survivability in a vehicle attack. Those are known. I've written and published about them in major magazines and journals and so forth, and certainly people can contact me or contact Mike to get those from me. But they're known. Vehicle attacks are not brand new. There's been a serious uptick in them, but there are things we can and should be doing to educate the public that revolve around very specific situational awareness ideas.
Okay. Michael, one of the questions that's just come up is a question about if you're looking to go with Everbridge, but you have a lot of your surrounding agencies haven't. Do they integrate? How do you make that connection if you're the one kid on the block that's using that particular tool?
I guess from what I'm saying, maybe I'm not understanding right, but and let me know if I'm not answering this right to the.
Well, I guess the question is that there are only a few agencies in their program, and they don't have that. There are other agencies you're working with as part of this response that don't have the program. How do we interface between the two?
Sure. So one of the things you can do is when you're pre-planning in terms of your response teams, you can add those outside agency groups into subgroups within your solution, those contacts. So when you're launching a notification, you're going to be working with those groups. You can do that and integrate with their solution that way. So they'll be able to get those messages. Hopefully that answers your question.
Okay. See, boy, we have got so many questions today. Steve, this one's for you, and I think I know where they're coming from. They're asking whether establishing a response system similar to an EOC would be advisable responding to these type of incidents. What would be that? Obviously, it'd be an on-scene command. Is standing up an EOC part of that operation? Would that make sense?
It depends on the scale of the event, but in most instances, the answer would be yes. You're going to obviously need your ICP, your incident command post, and your normal ICS structures on scene for coordination. But I tell you what, my experience, you're probably going to need the EOC function, because when you start to think about how many assets are going to be brought to bear on this, and just think about one part of this. Let's talk about mass casualties and the need to transport patients to multiple hospitals and locations and use different ways of transporting them. That you're going to have so many moving parts and moving in so many directions that you're going to need a central hub of coordination. So to my thinking and my experience, I think you're almost going to have to stand up an EOC. So if you already have an EOC, I think it would be good to exercise around mass casualty, just the EOC component, to see how you handle that surge, because it will be a surge. It's going to be a surge in street-level EMS. It's going to be a surge in both hospital, first responder and first receiver sorts of challenges. You can have complexities that are hazmats in the situation. It could be a CBRN complication on top of this. But just by virtue of, if we think about mass casualty, just by virtue of introducing that concept of being at a mass event, you're going to have so much to coordinate that it makes just good sense to me. I don't know how you do this well without an EOC of some magnitude.
Mm-hmm. See, one of the other things you mentioned in your presentation was the importance of two-way communications with the public. Have you got some suggestions for how we establish it? What does that actually look like in the field? Obviously you're going to be talking to people, but is there something more that we're considering here?
Well, there's two things. One, I'm going to kick part of this question back to Michael to talk about some of the different things that their technologies do at Everbridge. But the other is, if you think of it, it's an incredible case study, was in the Boston bombing of how through the city government they started to use social media just so effectively as, starting to bring civilians in as eyes and ears, and, and also the need to inform civilians too, and as they were moving into locking down different communities or locking in different communities and search for the remaining perpetrator. It's going to be necessary. So there are low-level communications that could be done through making sure that there's an awareness of what the municipal or what the jurisdiction's social media platforms could be done as a way to both give and get information. And then there's probably some features of the notification platforms that allow for that as well. So Michael, I'll kick that back to you for any discussion you could add about two-way capabilities, and things about accountability would be an example. Knowing where our employees or our students are in the wake of an event.
Yeah, I'll start with that last part, Stephen. Thanks for transitioning over to me. So with Everbridge, one of the things that we've identified working with some of our partners like Steve Cremando, and some of our customers is the need to be able to dynamically track employee locations. Traditionally with notification systems, really the only information you had on an employee in terms of contact data and location data was static information. And, in regards to an organization such as, Everbridge, that would mean, someone's office or desk line. For a university, that could be a professor's class or their office location. Unfortunately, or rather where we're moving towards is the workforce really across all industries is becoming more mobile. So that increases the need for us to be able to dynamically track locations versus just having static locations. So at Everbridge, we're able to do that in a couple different ways. And what that allows our users to do is be able to really identify who's in harm's path. So if you have a employee, as I had mentioned earlier in my example of the active shooter, in building A, you could have an integration with the badging system or set up where someone logs into a Wi-Fi in a certain building. They're there within our system, and it automatically updates their contact location. So if you were to draw a polygon on, as I mentioned, building A, you would be able to reach them even if their static location, their office location isn't in building A. That also lets you be able to ensure that people outside that building are getting the right message too, meaning if you want to make sure people are avoiding that building and avoiding harm's path, based off their current location, you can send them messages that are different than people you're saying to building A. And Everbridge lets you do that simultaneously through our incident templates. So what those are is basically you can build out an entire scenario, such as an active shooter, in all the different response groups you're going to need, all the different messages you're going to have out. You can build those all out in advance. In terms of two-way communication, say with that same scenario where you have an active shooter situation, maybe you want to see who got out of building A, so you can start tracking what employees are safe and which one are still in harm's path. You can, with our messages, you can deliver different types of messages, meaning instead of just sending a blank statement, you can send out a question, or a polling question. Are you safely out of the building? Are you in harm's way? Do you need help? Are you safe? Anything like that, and you can get real-time information through our two-way communication capabilities to figure out who still needs help and who is safe.
So I know we're tight on time, Lou, but I want to give you one example of that. You may remember there was a crowd strike in Times Square, New York, and the driver of the vehicle, it turned out, was, I believe, intoxicated or something of that nature. It wasn't terroristic in nature. But in Times Square, the local PD, the local NYPD, called for a lock-in and for all of those buildings, all those office buildings in the Times Square area, not to let anyone come in or out until they figured out the nature of the attack and what was going on. So that feature that Michael talked about like knowing where your folks are and also having that feedback loop where people can get back to you and say, I'm safe, I'm 2 blocks away, really makes a critical difference. Or I'm 2 blocks away and there's another attack happening here. Those are all like real important things to know. So that's kind of what we mean in terms of the two-way nature of it. It just can't be unidirectional, do this. It needs to be a feedback loop from the people receiving the information.
Great. We've gone just a little bit over our time, but I do want to get one last question in, if I could. And this is, we've talked a lot about the public sector folks, but there have been a lot of private sector folks on the call as well, and people like small businesses, preschools, so forth. Where can they look for information? Where can they, what sort of preparedness and training, what resources are available to them as well?
Well, there's a few different things. One, there's the kind of documents I shared, and they do have some applicability to these other agencies. Beyond that, I would reach out to your various states, your state offices of Homeland Security and Preparedness. Each state has a variant of that that can talk about and very often have trainers and training resources that could come to businesses, come to locations, do things like site assessments and give you some guidance around vulnerabilities and training. So I would start by looking closer to home, and if that means talking to municipal emergency managers up to county level emergency managers, and looking at 2 levels, and both your state police mechanisms and your state Homeland Security apparatus, there are usually very good resources there. They come to special groups. They work with the education sector. They work with houses of worship around these kind of challenges. So you probably have in your jurisdiction some really good resources. And if you have trouble finding them, reach out to folks like myself, and we could help you connect the dots and find those local resources. There's a benefit by looking what's out there in the literature and what's on the shelf. But honestly, nearly everything you will find on the shelf, even governmental recommendations, it will need to be customized to your unique locations. Obviously, what's happening in a large financial services firm is different than what's happening at the preschool.
Great. Thank you both very much. Just a quick reminder to the audience that if you do want copies of the slides, there is a PDF available by clicking on the webinar resources link at the bottom of your screen. Also, you will receive a copy, a recording of the presentation within the next 48 hours. It will be mailed to you, so you will be able to get that. And I'm sorry we're not able to get to all your questions, but feel free to reach out to either Steve or Michael if you have questions. And I'd like to take this opportunity just one last time to thank our speakers for what I've found to be a very enjoyable presentation, very interesting, and also to thank Everbridge, who has sponsored us and made this sort of thing possible for us. And obviously, thank you to all of you that have joined us, and we hope to see you back again in the future. Thanks very much for joining us.